So neoplasia. Neo in Latin means new, and plasia means abnormal growth. So neoplasia is a new abnormal growth. Cancer is the second leading cause of death in the United States. About 25% of all deaths are due to cancer. And 77% of those cancer deaths occur in people over the age of 55. Why is that? Because it takes usually some time for cancer to develop. And so most people that die of cancer, they're dying at an older age. However, keep in mind that you could die from cancer at any age. 1 out of 2 men have a risk of developing some type of cancer in their lifetime. And 1 out of 3 women are at risk for cancer. There are things that put you at higher risk for developing cancer. There are individual risks, genetic markers, for example, lifestyle, um, habits, environmental factors, are all can have risk factors that we can either mitigate or not. Age is something that we cannot mitigate, but cancer does take decades to develop. That's why most people diagnosed with cancer are older than 55. However, keep in mind that cancer can be diagnosed at any age. Family history. Again, this is something that cannot be mitigated. There are some inherited genetic mutations that could put you at higher risk for a small portion of cancers. People that have chronic health problems, such as ulcerative colitis, can markedly increase your risk for developing certain cancers. So people with ulcerative colitis have an increased risk for colon cancer. Certain habits, these are things that we can mitigate, right? So certain lifestyle choices are known to increase cancer risk. For example, we know that smoking increases your risk for cancer. If you drink more than one alcoholic drink a day for women of all ages or men older than 65, that puts you at risk for certain types of cancers. Or if you were a man younger than 65, if you're having more than 2 drinks a day, that puts you at higher risk for certain cancers. Excessive exposure to the sun or frequent blistering sunburns increases your risk for skin cancer. Being obese puts you at risk for certain cancers. People that have diets high in high in fat and low in fiber, increases your risk for colon cancer. Having unsafe sex can contribute to certain cancers. For example, HPV can cause cervical cancer in females. Environmental factors such as secondhand smoke, chemicals such as asbestos and benzene are associated with increased cancer risk. So this table is from 2015, and Table A is the estimated cancer cases for females and males, and Table B are estimated cancer deaths for both genders. So the most common type of cancer for men is prostate cancer, and the most common cancer for females is breast cancer. It doesn't necessarily kill them, but that's the highest cancer risk for the different genders. The second most common type of cancer for men is lung cancer, and it is also the second cause of cancer for women. And the third cause of cancer for both men and women are colon cancer and rectal cancer. So those are the 3 leading causes of cancer in both men and females, and that's how come we screen for those, right? We screen the females. They do self-breast exams. They're recommended to do a mammography after a certain age. Men after a certain age, their doctors check them for prostate problems. Colon and rectal cancer after a certain age, you are screened for that as well. It's recommended that you are screened for that. And then the 3 top leading cause of death related to cancer are lung cancer and bronchus cancer for both men and female. For men, the second leading cause of death due to cancer is prostate cancer, and for females, it's breast cancer. And colon and rectal cancer is the third leading cause of death for both males and females. So this table here is actually not recent. It's from 2008, but this is what's in your book. And these are the annual cancer deaths attributable to smoking. And so what I want you to get out of this slide is that there are other cancers associated with smoking besides lung cancer. It's the most common type of cancer attributed to smoking, but it can also cause oropharyngeal cancer, it can cause laryngeal cancer, it can cause esophageal cancer, stomach cancer, pancreatic cancer, bladder cancer, kidney cancer, cervical cancer in females. So smoking not only affects your lungs, but it can cause cancer in other parts of your body. That's what I wanted you to get out of that slide. So we're going to talk about benign cancers versus malignant cancers. So benign cancers usually end in oma. Examples: papilloma, adenoma, lipoma, osteoma. So a benign cancer often ends in oma. A malignant cancer often ends in carcinoma or sarcoma. For example, adenocarcinoma, osteosarcoma. These are malignant cancers. And what's the difference between a benign cancer versus a malignant cancer? Well, a benign cancer does not spread, it's localized. A malignant cancer spreads, it proliferates, it metastasizes, it moves from the original site and infects other cells. A benign cancer, the tissue of origin, if you looked at it under a microscope, is very similar to the cancer cells. So if you look at the cancer cells under a microscope, they look like the original organ cells. They haven't changed a lot. Another term for that is that they're well differentiated. They've undergone few mitosis. In other words, they haven't changed a lot. If you look at a malignant cell under a microscope, it looks nothing like the mother cell. They're going to be at an abnormal cell size. They're going to be an abnormal shape. In other words, they're undifferentiated. They've undergone many mitosis, many mutations. They don't look like the mother cell. And they also can have a characteristic called anaplasia. Anaplasia is when a cell has a different function than it normally does. Giving you an example here that I'm completely making up. So you might have breast cancer, and your breast cancer cells are now making thyroid hormone. I'm making this up. So breast cells generally don't make thyroid hormone, but now these cancer cells are making thyroid hormone. That's anaplasia. When the cell has the cancer cell has a different function than the normal cell. That's what anaplasia means. A benign cancer grows slowly. A malignant cancer generally grows faster, and it's metabolically demanding. In other words, it needs energy to grow. Cancer cells that are malignant release cytokines that stimulate blood vessel growth and vascularization of the tumor. So malignant cells need blood supply. And so they're going to release these enzymes that are going to cause these cytokines that are going to cause blood vessels to grow to feed that cancer cell. So it's metabolically demanding, cancer is. And that's one of the reasons why people with cancer, they lose so much weight. They lose body weight because they're using a lot of energy to keep that cancer cell alive. Tumor necrosis is common for malignant cancers. So because they need vascularization, the tumor may outgrow its blood supply, and so now it dies. And then it releases things when our bodies, when our cells die, it releases things that can damage our other organs. Tumor necrosis is rare for benign cancers. Recurrence after treatment is rare for benign cancers. It's common for malignant cancers. If untreated, malignant cancers have a poor prognosis. Benign cancers, even if you don't treat them, they generally have a good prognosis. They can cause harm if they get so big that they're putting pressure on surrounding tissues. But generally, the tumor itself doesn't cause any damage unless it gets too big and it's putting pressure on other tissues. So let's watch this YouTube video that shows us the slow growth of a benign tumor.
One out of four persons will be diagnosed with cancer, and in many cases, current therapy does not provide an effective cure. Biologists know that normal cells divide in a highly regulated and strictly controlled manner, and that cancerous tumors are formed when a cell becomes abnormal and divides without control. Cells of the immune system are capable of detecting and killing these abnormal cells.
So the sound is low. Let me see if I can increase the sound. I have everything maxed out. I wonder why the sound is so low. Okay, so hopefully you'll be able to hear it. I'm going to start it again. If not, you have the YouTube URL, so just click on it if you can't hear it on this recording and view it yourself.
One out of four persons will be diagnosed with cancer, and in many cases, current therapy does not provide an effective cure. Biologists know that normal cells divide in a highly regulated and strictly controlled manner, and that cancerous tumors are formed when a cell becomes abnormal and divides without control. Cells of the immune system are capable of detecting and killing these abnormal cells, but in cases of serious disease, the rate of cancer cell division surpasses the effect of the immune system, and the tumor continues to grow. In order to acquire nutrients that are necessary for growth, the tumor cells release a growth factor called PLGF that binds to receptors on nearby capillary blood vessels. This causes the capillary network to expand through the tumor, providing increased blood supply and stimulating tumor growth. Scientists have discovered that this process can be blocked by the administration of a small molecule called anti-PLGF antibody. The antibody binds to the PLGF growth factor, thereby preventing it from associating with the capillary vessel. This effectively blocks the expansion of the capillary network, and tumor growth is slowed because of limited blood supply. Because of the strong positive effect of the anti-PLGF antibodies, the cancer-killing cells of the immune system now work faster than the rate of cancer cell division, resulting in a marked reduction in tumor size.
Okay, so that video.
DNA duplicates. After the S phase, there is a G2 phase.
Okay, so that video that we just saw is actually not a video of a benign tumor, but it's actually the video of a malignant tumor, where you saw how it was making new blood vessels in order to feed the tumor, right? So that was actually a video of a malignant tumor that we just saw. So we said that most malignant tumors either end in carcinoma or sarcoma, but there are some exceptions. So melanomas, lymphomas, hepatomas, and leukemia are all malignant types of cancer. So in addition to carcinoma and sarcoma, there are some omas that are related to cancer, malignant cancer. So melanomas, lymphomas, hepatomas, and leukemia. So the basis for cancer are mutant genes. And so we all have proto-oncogenes. And these proto-oncogenes, you'll have overactivity that can cause mutations. And tumor suppressor genes, we all have them. People that have cancer will have malfunction of the tumor suppressor gene. An example of a tumor suppressor gene is the p53 gene. So here we see a picture of a pap smear of the cervical cells. And here is a normal cervical cell, and here is a cell that is cancerous. Note that this cell looks nothing like this cell. It has mutated a lot. Therefore, this is a type of malignant cancer because when you look at it under the microscope, it looks nothing like the mother cell. So let's view this YouTube video about cancer.
Normal cell division in the body depends on a precisely regulated set of events that determine when a cell will divide and when it will not divide. Two types of genes called proto-oncogenes and tumor suppressor genes are primarily responsible for this regulation. When mutated, however, proto-oncogenes can become what scientists call oncogenes, genes that stimulate excessive division. This situation is similar to getting a car's accelerator stuck in the downward position. A cell that experiences such mutations tends to divide more frequently than it normally would. In contrast, mutated tumor suppressor genes can become inactive. A cell that experiences a mutation in a tumor suppressor gene loses some of its crucial breaking power. Again, the result is a tendency for the cell to divide more frequently than it normally would. For a cancerous tumor to develop, mutations must occur in several of a cell's division-controlling genes. These mutations disturb the balance that normally exists between signals that stimulate cell division and signals that inhibit cell division. The result is uncontrolled division.
Okay, so with cancer cells, you have uncontrolled division
Hi, this
of
is
those
Andrew
cells.
Wolf. In this video, I'm going to be talking about tumor suppressor and oncogenes. So if you didn't watch my prior videos, I was really talking about cancer.
Okay, so to reiterate what we just saw previously, our body has trillions of living cells, and they grow, they divide, and usually die in an orderly fashion. And this process is usually tightly regulated by the genes within the cell's nucleus. So within the nucleus, there's genes in those cells, and these genes code for proteins and help regulate cell growth. These genes are called proto-oncogenes. So proto-oncogenes are genes that regulate normal cell growth. Our cells are constantly dividing, and when they divide, we call that mitosis. And so proto-oncogenes help to regulate that the rate at which our cells divide. A change in the DNA sequence of those proto-oncogenes gives rise to an oncogene. So now we have oncogenes that are dividing more quickly. These oncogenes will produce different proteins and interfere with the normal cell regulation and has the potential to cause cancer. Most normal cells will undergo a programmed form of rapid cell death that's called apoptosis, when critical functions are altered. So when we get these oncogenes, normally the killer cells notice that and they will kill that cell, and that's called apoptosis. So activated oncogenes can cause those cells designated for apoptosis to survive and proliferate instead. So cell division is called mitosis. So during mitosis, one cell divides once to form two identical cells. And the major purpose of mitosis is for growth and to replace worn out cells. Some cells are labile, in other words, they undergo frequent mitosis. For example, our skin cells, our epithelial cells. We are constantly sloughing off old ones and new ones are constantly growing. In fact, the dust in the room is usually skin cells that have sloughed off. Some cells are stable. They don't undergo mitosis unless they're damaged. For example, liver cells. Normally, liver cells don't reproduce very often unless we damage them. And then they have to reproduce, and generally they reproduce abnormally. That's how come people that develop liver failure secondary to alcoholism, the alcohol damages the liver cells, and they have to now regrow, but when they regrow abnormally. Some cells don't divide at all, for example, nerve cells and cardiac cells. That's how come when you have a spinal cord injury, generally, if that nerve is severed, it's going to be severed for life because those nerve cells do not regenerate. That's how come after you've had a myocardial infarction, those cells that have died in your heart muscle are dead forever because those cells do not divide. They remain in what's called the G0 phase. And we'll talk about the G0 phase in a minute. So what is cancer? Cancer is mitosis gone wrong. So let's watch this YouTube video about mitosis.
Hi, it's Mr. Anderson, and welcome to Biology Essentials Video 28. This is on the cell cycle, mitosis, and meiosis. In other words, how we go from one cell to all the cells, the trillions of cells inside our body. Meiosis is important because that's how we make sex cells. Now, let me digress a little bit. This is a whiptail lizard from the desert Southwest, and what's interesting about this is that it's a female lizard, and when it wants to make more lizards, it will simply use mitosis to make an exact copy of a cell inside its body. It's called parthenogenesis, or virgin birth, and it will make a brand new number of baby lizards, and they're all females, so they don't have males. It's rare to not have males. It's rare to not have meiosis, and the reason why is that all the whiptail lizards are genetically the same, but it works, and if you live in a fairly stable environment, it tends to work. Now, we're not going to go into the specifics of mitosis and meiosis. You can look, I've got videos on each of those that talks about the different phases. What I want to talk about this is, in general, what do mitosis and meiosis do, and how does the cell cycle work, and how is it controlled? And so a diploid cell is going to be a typical human cell, or a typical cell inside an organism. It's going to be 2N, and what that means is it has two complete sets of chromosomes. So, for example, in humans, 2N equals 46. That means we have 46 pair of chromosomes. And so the goal of the cell cycle in mitosis is to make a copy of that cell. In other words, to make a diploid cell. That diploid cell can enter into the cell cycle again, make more cells and more cells and more cells. And so the way that we make new cells in our body or replace cells that are damaged is mitosis. In meiosis, we're going to take a normal diploid cell, and we're actually going to make a haploid cell. We're going to make sperm and egg. And so in humans, N now equals 23. Now, if we were to just stop there, we wouldn't have diploid cells anymore. But fertilization, where egg meets sperm, is going to combine those two cells to make a diploid cell. And now that diploid cell can enter into the cell cycle again. And so we've got kind of two loops. We've got the mitosis loop and the meiosis loop. Mitosis is used to make all the cells in our body. Meiosis just makes gametes or sex cells. I also in this video want to talk about how we control the creation of diploid cells that may be better to come from here, and how we use cyclins. An example of that would be the mitosis promoting factor to control the cell cycle and where it is and where it's headed next. Now, if you're talking about cell cycle, the best place to watch is with videos of actually cells dividing. And so this is a cell undergoing division. So we start with one cell, and it makes an exact copy of itself. Now, when you're watching it, let me go back a second. On these first two videos, what you don't see is everything that actually happens before the cell makes a copy of itself. In other words, before the cell is actually able to divide, it has to duplicate all of the DNA and all the machinery of the cell. This last one, we're looking actually inside the cell itself. And so the cell division actually has two parts to it. Part one is going to be the division of the nucleus, and we call that in general mitosis. And then after we've divided the nucleus, you'll see the chromosomes actually separate here. Then we actually have the division of the rest of it, and that's called cytokinesis. Cytokinesis is the break apart of all the other parts of the cell. So the machinery of the cell, the mitochondria, cytoplasm, things like that. And so let me see if I can start that up. So first of all, there we go. First, we have the division of the nucleus. You can see the chromosomes pulling apart, and then you have cytokinesis, or the division of the cell itself. And so all mitosis is one cell forming two cells, and those two cells are identical to that first cell. And that's how we go from that first fertilized egg inside us to the trillions of cells that we have inside an adult body. So when you're replacing cells in your body, you're doing it through mitosis. So let's look at the cell cycle. And so what happens is you'll have a cell enter into this. So a cell is going to look like this. It's going to enter it into the cell cycle as one cell. Make a little better arrow. And then it's going to eventually exit out as two cells. Each of those cells, remember, could go back into the cell cycle. And so this is how we make all the cells in our body. Now, I've heard that a lot of the dust in a room actually are dead skin cells. And this is what skin looks like. So skin is going to be created new cells, and then they're going to migrate up to the surface, and then we're eventually going to lose skin cells at the top. But we keep replacing those cells, and to do that, we use the cell cycle. So let's look at the parts of the cell cycle. If we start first with that cell entering in, the first thing that it'll do is it'll actually enter into the G1 phase. G1 phase, the cell is actually going to grow. It's going to get bigger and bigger and bigger and bigger. We then enter into the S phase. During the S phase, we're going to actually, using DNA replication, we're going to copy all of the DNA inside a cell. It then goes into the G2, or the growth 2 phase, where it continues to grow and gets ready for division of the actual cell. And so G1, S, and G2 are all part of what's called interphase. And if you look at a cell, it's generally in interphase. It's growing, it's copying its DNA, it's growing, or maybe it's just working. It's doing what a normal cell does. And so most of the life of a cell is in interphase. It's in these three, G1, S, and G2. And the actual copying of the nucleus and copying of the cell, this mitotic phase, is actually going to be really, really small. If it never divides again, it'll actually stall out in something called the G0 phase. And so we've got cells inside our body. You've heard of this, maybe cells of the central nervous system, muscle cells, for example, that never copy themselves during your whole lifetime. They're in what's called the G0 phase, or they're just waiting, and they're not going to make divisions. And so how does a cell know when it's time to divide and when it should go on and when it shouldn't? The best analogy I can think of is it works kind of like an hourglass clock. And so there are little proteins inside a cell, and as those proteins accumulate throughout the life of the cell, eventually you get a critical number of these proteins at the bottom. And once we have enough of those, then it actually tells the cell to advance to the next stage. And those proteins are called cyclins. So let's look at what cyclins look like. A cyclin, I'll represent it here, it's simply as a protein. But if we look here at the G1 phase, the S phase, the G2 phase, and mitosis, there's a set of cyclins, or a set of these different types of proteins And what they're going to do is they're going to build up. And so cyclin A and B are ones that I'm really familiar with. Cyclin A will actually build up during the S phase, and then it'll drop off right as the cell divides, as it goes into this mitotic phase. And so cyclins will actually accumulate. And so those are like the sands through an hourglass. They're going to get more and more and more and more cyclins as the cell goes through the cell cycle. Now, the other chemical that I want to talk about is something called CDK. CDK is simply a cyclin-dependent kinase, and a kinase is simply going to be a chemical that can speed up actions within a cell. And so CDKs are found in all living organisms, and you can actually take CDKs from a yeast and put them in our cell, and they work just as fine. So they show homology through evolution. And so cyclin-dependent kinase, if you look at their name, are simply dependent upon cyclin. So I made a little of animation of how that works. And so a typical cell in your body is going to have a bunch of CDKs in it, or cyclin-dependent kinases. And so we could say this is like right here. But throughout the life of the cell is going to start building up and accumulating larger amounts of cyclin. So the amount of cyclin is going to get larger and larger and larger. So eventually what happens is the cyclin is going to fit into the cyclin-dependent kinases. Now we have an activated CDK cyclin complex. What does that mean? We have something, a protein that's able to do things. So now you can think of, we've like mustered this army, and now the army is ready to do something. And so what does it do? Well, we're right here, so we're just about to enter into the M phase. So we're just about to do mitosis. And so what these cyclin-dependent kinases do is they act on the cell itself. So they are a specific type of CDK is called the mitosis promoting factor, or MPF. And what that does is when it builds up enough of these cyclin-dependent kinases, they're actually going to work on the cell. So one thing they'll do is they'll actually break apart the nucleus. So we were able to start dividing that cell. Another thing that CDKs will do is they'll actually work on the microtubules that build this spindle. And so all of these together will work on pushing that cell into the mitotic phase, or to this next step of the cell cycle. The neat thing about each of these is that after they've actually done that, they'll actually gobble themselves up, they'll disappear, and then the whole cycle begins over again. Okay, so if we kind of talk big picture about what happens in the cell cycle, a typical cell right here is going to be, let's say this is a typical cell. A typical cell right here is actually going to be 2N. It's diploid. You have one chromosome from mom, one chromosome from dad. So in this case, it's going to be 2N equals 2. It's then going to duplicate itself. So during the S phase, it's going to make copies of itself. And so at this point right here, we'd actually have a 4N cell. It's made copies of that. And at this point, we can either take the path of mitosis or the path of meiosis. And so in the path of mitosis, that'll simply split in half, and now we'll have two 2N cells. And if you look at these two 2N cells, they're exactly the same as that first cell. So this is what's happening to the chromosomes. If we look at that 4N cell, and as it goes into mitosis, it'll actually line up, it'll split in half, and then it'll split in half again. And so what you have is actually N cells. Those are called haploid cells, and we have 4 of those in meiosis. And so the cell cycle will take a diploid cell, make 2 diploid cells in mitosis, or make 4 haploid cells in meiosis. That got a little messy, so let's look at it in a little bit more detail. So mitosis is how we replace cells in the body. So cells that are broken, cells that are broken down, cells that we need to replace, we do that through mitosis. Or when we want to grow, how do we go from a very small organism to a very large organism? It's just making more cells. And so this would be to make it simple, we're going to start with a simple cell. This is going to be a 2N, it's diploid, but 2N equals 2. So this would be that first parent cell. It'll then duplicate all of the DNA. So now we have this characteristic shape. It has 2 sides to it, and this side and that side are copies. That's what happened during the S phase. They'll then meet in the middle. They'll divide in half. So this would be our mitosis phase, and now we have 2 diploid cells. And if you look at those cells, they're exactly the same as that original cell. And each of those are 2N equals 2. So that's mitosis. What happens to these 2N cells? Well, they can enter into the cell cycle again, and it goes over and over and over again. In meiosis, what happens is a little more detailed. Remember, meiosis only deals with making sex cells or in reproduction. And so in this case, to make it to show you meiosis, I had to increase the number of cells. In this case, or chromosomes, 2n equals 4. In other words, we have 2 chromosomes from mom, 2 chromosomes from dad. So they'll copy themselves. So now we actually have a 4n cell at this point. But since we're doing meiosis, this is where actually crossing over occurs. And so parts of this chromosome will swap places with this chromosome and vice versa. What that gives us is variability in all of the sperm in the egg. They'll divide in half. Now we have 2n cells, and then eventually we'll have n cells equals 2. And so we started with 2n equals 4, now we have n equals 2. Each of these 4 things in a male become a sperm, and in a female, one of them will become an egg, and the other ones will actually form what are called polar bodies. And so what do we get after meiosis? Well, we get sperm and we get egg. And we can then go from these original 2n equals 2 to eventually, or n equals 2 to a 2n equals 4 zygote. And so now we're back to a diploid cell, and that diploid cell could enter into the cell cycle. This is a zygote to make more cells, and eventually make sex cells to make the next generation. So that's cell cycle, mitosis, meiosis, and I hope that's helpful.
Okay, so this last video that we just saw,
Good grammar and spelling are important, but if you want to write essays that inspire, messages that forge brighter connections, and emails that get the job done, you need to think about more than just grammar and spelling. This sentence is grammatically correct, but it's wordy and hard to read. It undermines the writer's message, and the word choice is bland. Grammarly's cutting-edge technology.
Okay, so as I was saying, in that last video we just saw, they were talking about mitosis and meiosis, and we're concerned with mitosis in regards to cancer. So the meiosis information, although it's good to know, it's not required for this lecture. So what is cancer? Cancer is mitosis gone wrong. So as we saw in the video, the S phase is the synthesis phase. It's the part of the cell cycle in which DNA is replicated, and it occurs between the G1 phase and the G2 phase. In order for the S phase to occur, the cell needs nutrients and energy and other external factors. Now, the purpose of mitosis is to produce 2 similar daughter cells. The complete DNA instructions in the cell must be duplicated. So, you have here, when you have a normal cell, mitosis, what happens is that one cell makes 2 exact cells. And then those 2 cells are going to make 2 more exact cells. And then those cells are going to make 2 more exact cells, etc. And normally, when you have an abnormal cell that shows up, and we all make abnormal cells, that has a mutation in the DNA, then normally we send enzymes to fix it. And if we cannot fix it, then we do apoptosis on that cell and the cell dies. That's what normally happens. So with cancer cells, they're going to proliferate despite the lack of growth initiating signals. So we're constantly sending signals for cells to duplicate. And also another thing that the cancer cells do is they escape apoptotic signals. So they don't die. They are immortal. And so these cancer cells will replicate unlimited. They'll have unlimited replication. So again, you have a cell that divides into 2 cells. And then that cell is going to divide into 2 cells, and the next cell is going to divide into 2 cells as well. Now you have a cell with mutated DNA. And so what's going to happen is that we are going to try to kill it, but cancer cells don't die, right? So now they don't go through apoptosis, and now you keep replicating these cancer cells. Another thing that happens with cancer cells is that activated oncogenes can cause cells designated for apoptosis to survive, and instead of dying, they're proliferating, as is occurring here. And so now these cells proliferate, these abnormal cells. So there is no cell death, there is no apoptosis in cancer cells. And so now you get this abnormal growth and you get a tumor. So these malignant cells can metastasize, they can migrate from their site of origin and invade local tissues and overrun their neighbors. And so now the neighboring cells get overrun. So these cancer cells, they lose their differential features. They don't look anything like the mother cells if they're metastatic, and they don't contribute to the function of the tissue. So let's watch this cancer video. I'm not sure if this video is still working. Let's see. Yeah, I don't think this video works anymore. Okay, so okay, I think I found that video, so let's see if I can get to that video.
One out of every 2 men and 1 out of every 3 women will be diagnosed with invasive cancer in their lifetime. For this reason, it's really important to know more about what cancer is, what makes it up, and how it's treated.
At the simplest level, cancer or cancer cells are cells that have lost the ability to follow the normal control that the body exerts on all cells. In our body, we have billions and billions of cells, and they have different functions. It's a very complicated process under incredibly phenomenal control. And if something goes wrong and that control is lost, then particular cells escape the normal control mechanisms, and they continue to grow, and they may spread. That's what we call cancer.
As those cells grow and divide, they turn into a mass, or they clump together, and that's what we would call a tumor. And then they can get smart and then spread other places, and that's what we call metastasis.
Cancer can actually occur anywhere in the body because there are cells everywhere in the body. In women, one of the most common cancers, of course, is breast cancer, and in men, prostate cancer. And in both men and women, lung cancer and colon cancer are common cancers.
One of the things we're now learning is that just because you have breast cancer doesn't mean that your breast cancer is the same as the person that's sitting next to you that may have breast cancer. And therefore, you can get an individual treatment plan that's based on you as an individual and your particular cancer type.
Once the diagnosis of cancer is made, of course, the next obvious question is, what do you do? There are several things that are really relevant. It's the stage of the cancer, which is information about where is the cancer. You say it's a particular kind of cancer. How much cancer is present? Has it spread? Is it in lymph nodes? Has it spread to other organs of the body? Cancer treatment actually is very complex. And part of the reason is because cancer is this constellation of over 200 different diseases. They have common characteristics, but they're all very different from each other. In addition to that, the cancer itself is not homogeneous. There may be 3 or 4 or 5 or 6 different slight variations in the cancer cells that are there. People ask, why? Why does my cancer not go away? It shrunk by 70%. What's wrong with the other 30%? Well, it's probably a different subtype of that cancer, which is going to require a different kind of treatment.
Primary methods for treatment of cancer are surgery, radiation, and chemotherapy. Surgery is when you literally remove the cancer. You make an incision, you find the cancer, and you cut it out. Radiation is actually taking what we call photons, the same thing that you use to take an X-ray picture in order to treat a focal area of cancer. Chemotherapy is using a drug or chemical that's either taken by mouth as a pill or given through an IV into the vein, targeting those cells that are dividing more quickly.
Receiving a diagnosis of cancer can be a frightening thing. The good news is that today is probably the most exciting time in history in terms of the treatment of cancer. Options that didn't exist a few months ago certainly didn't exist a few years ago, like the ability to genomically profile a tumor and to take that individualized fingerprint of that cancer may direct us to tailor treatment in very specific ways.
As we learn genetic abnormalities in individual cancers, we're able to more effectively target those abnormalities for the individual cancer, not only to improve the outcome for the patients relative to the cancer, but also hopefully result in less side effects, because the targets will hopefully be less in the normal tissue and more in the cancer itself.
New drugs have now been designed to teach the immune system how to see the cancer cells for what they are, so the immune system can actually do the job at killing off those cells. We've unlocked a key interaction in how cancer cells and immune cells interact, and by affecting that interaction, teaches the immune cell to be smarter and see the cancer cell for what it is and get rid of them.
At Cancer Treatment Centers of America, we have a very robust integrative oncology program. Integrative oncology is taking those conventional oncology treatments and integrating those with therapies like acupuncture, naturopathic medicine, chiropractic, nutrition, to blend those together and to create the most appropriate treatment plan for that individual patient at that moment in time.
So having your symptoms and side effects under control, having your nutritional status and your immune system, as well as your energy supported during treatment, better positions you to fight the cancer and tolerate the treatment course. Cancer Treatment Centers of America has all of the resources under one roof. All of these team members really try to address any sort of side effects or symptoms that you may be having before they occur. If we can keep your body strong, if we can keep your hope up and you feeling strong emotionally, and if we can keep your immune system in a good place, you're going to tolerate the treatment much better.
No matter what cancer you have, this is a person who has a life and family and friends and so forth. And so my goal as an oncologist is to not only get rid of the cancer, but for you to then live a normal life again.
I've been an oncologist now for over 30 years, and the options for treatment are the best that I've ever seen them. They're more effective with fewer side effects and faster recovery, so that you can live as normal life as long as you can. We've never had better opportunities than we do today.
Okay, well, I found the site, but they changed the site to be more of a commercial. The previous video that I saw was just explaining what cancer is. But let's go back to the PowerPoint. Okay, so we did this one already. Let's see. All right. So there's different effects of proto-oncogenes that can activate the growth of cells. And so they can develop treatment that can target any one of these phases in the effects of the signaling pathways. So the following are cell signaling systems that promote cell proliferation. So one is growth factors, also known as mitogens. And what those are small peptides that are manufactured by cells and secreted into the intracellular space. And they bind on the receptors that are found on the cells. So these peptides will bind to the receptors, and they will cause then to encourage the cell to divide. So one way to treat cancer is to target these mitogens, these growth factors. Another way that cells can proliferate is that these receptors can be mutated. So now you're making more receptors than usual, and so these receptors will also have a greater affinity for growth factors. And so growth factors will attach to it because they're more attracted to these receptors that are mutated. And so now you have more growth factor receptors, and then when they get activated, you're going to have more cells. It causes proliferation or growth of cells. Another problem can be in the cytoplasmic signaling molecules. So within our cells, we have enzymes and chemicals that transmit signals from activated receptors to the cell nucleus. So we can have abnormal cytoplasmic signaling molecules that are telling the cell nucleus to replicate. And then we can have abnormal transcription factors. So transcription factors and cell cycle regulators spur the cell to enter into the synthesis phase. And so if you have abnormal transcription factors, then that will cause the cell to replicate more quickly. So these are 4 ways where the cells might be growing abnormally, and there are now treatments that target each one of these types of abnormal proto-oncogene activation of growth signaling pathways. So let's watch this video here.
Carcinogenesis. The body features a number of complex organ systems. Organs are made of specific types of tissue, which are composed of cells arranged in an orderly fashion. Each cell contains genes made up of sequences of DNA. These genes determine various cellular properties, such as the function and lifespan of the cell. A change in the DNA sequence, called a mutation, alters the way a cell performs some of its functions. This mutation may be a trait inherited from the mother or father, or it may be a spontaneous change that occurs over the course of an individual's lifetime. In addition, carcinogens, such as radiation and a variety of chemical factors, can cause changes in DNA.
Normal cells grow, multiply, and die on a regular controlled basis. While a cell grows, the DNA contained within the cell is duplicated. The cell then divides in half to create two new cells by a process called mitosis. This division process is controlled by multiple factors. Two specific types of genes control cell growth and division. Oncogenes act like on switches and give commands for the cell to grow and divide. Tumor suppressor genes tell the cell to stop growing and dividing, similar to an off switch. If damaged, oncogenes may give a continuous on command. Similarly, damaged tumor suppressors may not give an off command. These errors will allow the cell to grow and divide uncontrollably. In addition, growth factors, such as hormones, modulate the proliferation of cells. The body naturally controls these growth factors. However, external factors such as chemicals that mimic or change amounts of growth factors can alter these processes. Overexpression of growth factors is associated with increased cell division. Without repairs to damaged oncogenes and tumor suppressor genes, or with increased amounts of growth factors, there can be exponential growth of damaged cells.
One out of every two